I need Advil. It's been a rough day. I need some Advil.
Where's the Advil?
Well, what my teammate didn't know is that she was really asking for ibuprofen. Many people know ibuprofen as the brand names Advil or Motrin, but it can also be found in generic forms. Where can I get ibuprofen? Well, lots of places.
Walmart? Five Below.
You can even get it at Sheetz while you're pumping gas. Your doctor can also write you a prescription if you need a larger dose, such as 800 milligrams. But what is Advil specifically treating?
Pain.
Everyone experiences pain. It's not a new phenomenon. Even the cavemen felt pain. But pain is good because it tells you to stop doing something that's harming your body, like holding your hand on a hot stove. But pain hurts, so man tried to alleviate it with painkillers, also known as analgesics.
Some guy realized that when he chewed on the bark of a willow tree, his pain and fever actually reduced. This was the beginning of the development of painkillers. Hippocrates came along and then made a powder from this bark and used it to treat people's pain. In 1838, Raphael Pereira extracted acetylsalicylic acid from the bark, and by 1897, it hit the market as what we know today as aspirin. We also know today the history of opioids, which are from opium poppies. The joy plant has been recorded as far back as 5000 BC, and by 1527, Paracelsus mixed opium with alcohol to create the perfect painkiller. But in 1804, Frederick Serturner was able to isolate opium's active ingredient, and he called it morphium. They knew morphine was highly addictive. Therefore, in 1897, the researchers who developed aspirin developed heroin, which was supposed to be less addictive than morphine. Then by 1910, they realized it was actually more addictive. Today, opiates are still the best pain relievers, but as we all know, they are highly addictive.
Around 1950, a group of scientists led by Stuart Adams from a company called Boots wanted to invent something other than aspirin to treat rheumatoid arthritis. In 1961, a patent is filed for 2,4-isobutylphenyl propionic acid, aka ibuprofen. In 1966, clinical trials of ibuprofen began in Edinburgh, Scotland, and it showed it is a great anti-inflammatory. In 1969, ibuprofen is launched in the UK only for prescription use. In 1983, because of ibuprofen's great safety record, it became available over the counter. To make ibuprofen, Adams and his team started with 2-methylpropylbenzene, and poof! Magic! Ibuprofen was formed.
Ibuprofen itself is not soluble in water. Therefore, scientists react it with a soluble compound, in this case the amino acid lysine, to form a salt. Therefore, it becomes ibuprofen lysate. This is what is absorbed in your bloodstream. After your stomach breaks down the pill, it is now able to dissolve in your blood and be transported throughout your body. With the invention of ibuprofen, it entered the category of non-steroidal anti-inflammatory drugs, also known as NSAIDs. NSAIDs are great because they are not addictive and they don't have any extremely nasty side effects. Commonly known NSAIDs include ibuprofen, like Advil, aspirin, such as Bayer's, Celebrex, and naproxen sodium, such as Aleve.
But how does ibuprofen work?
When your cells are damaged, for example, in a fever or injury, your cells release a chemical called arachidonic acid, which is the key to the lock or enzyme cyclooxygenase. Cyclooxygenase has two forms, 1 and 2 and is abbreviated as COX. When arachidonic acid reacts with COX, it forms prostaglandin H2, which sends many different types of signals throughout the body. COX-1 deals with maintenance of the lining of the stomach, and COX-2 deals with inflammation. Prostaglandin H2 lowers your pain threshold, which makes pain occur more easily. For example, your pain threshold is lowered when you have sunburn, and simply putting on a shirt can be excruciating. Pain signals are sent to your brain saying, "Ow, this hurts," and you stop doing whatever is causing the pain. These signals are good because, again, they protect you from something that's harming your body. For example, pulling your hand off a hot stove. But if the pain is persistent and you want it to stop,
So that's when you take those pills, kiddos.
your body breaks down those pills. They enter your bloodstream. The ibuprofen begins to target the COX enzymes. Only COX-2 is necessary to get rid of the pain, but it also fits the active site of COX-1. Ibuprofen acts as a key that fits in the lock but doesn't open the door. Arachidonic acid can no longer fit in the active site, therefore prostaglandin H2 is not made and pain signals are not sent. After about 4 to 6 hours, the COX-1 and 2 enzymes spit the ibuprofen out, and arachidonic acid can again create pain signals. Other NSAIDs work differently. For example, when aspirin attaches to the active site of the COX enzymes, part of it breaks off and the whole enzyme permanently deactivates.
One cool thing to know is that ibuprofen has mirror image.
Scientists label the right and left ibuprofens as S+ and R-. In your body, only the S+ form can fit into the enzymes. But naturally in your body, you have an enzyme that converts the R- form to the usable S+ form. So a dose of about 400 milligrams of ibuprofen contains 200 S+ and 200 R-, but about 60% is converted, therefore really you have 320 milligrams of active ibuprofen.
But I don't really care about this science stuff. How does ibuprofen benefit me?
Meanwhile, the next day,
I have a huge fever. Oh my gosh. Today's Monday. Holy crap. I have the chem project due to present. Crap. Oh wait. Good thing I have some ibuprofen.
Oh, it's that time of the month again. I need some ibuprofen.
3 more chapters, 5 more study guides, and another worksheet. Oh, my head hurts from all this A-push.
Here, sweetie, have some ibuprofen for that headache.
Coach gave us 10 rope climbs, 100 handstand push-ups, and 500 squats. I'm a little sore, so I think I'm gonna go upstairs and take some Advil.
In small doses, it's even safe for dogs.
Just remember to take ibuprofen for acute somatic pain. It is not recommended for severe pains like surgery. Also, future benefits include applications in Parkinson's disease, Alzheimer's disease, and altitude sickness. And to use ibuprofen as a preventative treatment, take it before your activities rather than after. For example, these gymnasts took ibuprofen before their meet so they could have happy gymnastics.
Clap along if you feel like a room without a roof. Clap along.